Now we'll quickly try to combine about 3 tests and look at this test. Okay, of course they are usually done from the chest down to the waist. So we'll look at how these tests are done, and we'll look at reasons why you might actually need to do this test. So we're looking at the Schober's test, we're looking at the chest expansion test, and we're looking at the lateral spinal flexion test. Lateral spinal flexion, like we are moving to the side as a patient. Okay, so don't worry, all of them you get to look at the pictures and get to appreciate. So this is what is now the Schober's test. So it basically measures what? Lumbar spine flexion. Okay, it measures lumbar spine. How far can your lumbar spine go? Do you understand? So procedure will say that the patient stands upright. The examiner marks a point at the level of L5, then another point 10 centimeters above. Okay, so what happens? See, mark 1 here. Okay, 10 centimeters above. Okay, so what next? The patient bends forward, tries to touch his toes. So the distance between the two marks is measured again. So how flexible is your spine? Do you understand? So interpretation, if it increases more than or equal to 5 centimeters, it's okay. But if it doesn't increase up to 5 centimeters, that should say that there's a lot of stiffness around that place. Do you understand? So usually they use it to diagnose all those restrictive issues that could occur, inflammation, injuries, and the rest of it. Okay, then chest expansion test. You can see how you put your hand at the back of the patient, so as they are breathing you are trying to look at how it is expanding and coming. So they use it to access thoracic cage mobility and lung expansion. So procedure is a non-stretch, okay, but you can use a tape, you can use your hand too. This is a skill, right? You can use a tape, you can use your hand. So we say that a non-stretchable tape is placed, at the back of the chest, commonly at the 4th intercostal space or Z4 level. So the patient is exhaling fully, then inhaling maximally. So the difference in circumference is recorded. So in adults, normally 5 to 8 centimeter difference in expansion is typical, but if the expansion is low, that's show that the patient is not breathing fully. He's breathing small. You understand? Because probably there's a pain there or something. So they use it to diagnose all those interstitial lung disease, ankylosing spondylitis, anything that is restricting you from breathing in fully. Then lateral spinal flexion test. Just bend it to the side. This one, so they are checking for the flexibility of your spine and also if there's any issues in the rib cage. So it measures the side bending mobility of the spine, often used in ankylosing spondylitis test, but it depends, you understand. So procedure is that the patient stands upright, then they actually slide one hand, like one of your hand is pointed down, so slide it down to the leg. Okay, you don't open your hand, no, put it down, then slide it down. You get it? So distance from the fingertip to the floor or change in hand position is measured. Okay, so usually if they are able to go 20 to 45 degrees of flexion, it's fine. But if there's any reduced, that will tell you that the spine is having some pain. Do you understand? Ankylosing spondylitis, scoliosis, degenerative change, anything that is making you not be able to use your spine to its maximum potential, you can use this test to actually pick it up.